This is part 2 if you're studying for your EFDA exam, okay? If you're trying to self-study and take the exam on your own with your doctor helping you learn how to do the restorations, the tangible work in the office, and sign off on that. Or if you're studying for your RDA or CDA, this will also help you. A lot of it is the same material. Let me repeat, a lot of it is the same material. It is more the hands-on and getting with your doctor and practicing everything that you can place within the oral cavity. Now, chapter in the modern dentistry book was 56, oral and maxillofacial surgery is what I'm going by, okay? And one of the questions that you might come across will be dislodgement of a clot from the socket or infection in socket that results in a failure of healing process can lead to. Now, if you haven't gone over oral surgery yet, a Drysocket can come from that and Alveolitis, okay? Now, that's the dislodgement of a clot. If you ever scraped your knee, it gets like a little scab over it. Same with your tooth. Once the tooth is removed, the tissue within the socket has to heal and form and seal itself back in and close up. Now, let me see here. I might have a model that shows us. Okay. Let's see here. Now, if you haven't got time to watch this video and you're studying to become an EFDA or take your CDA or RDA, I strongly recommend you save it on a playlist of videos that you're watching to help study and assist in your studying. Okay, so I don't have one right now, but here, look. The tissue has to form over. It has to close back in. And it takes a little bit for that to happen. Now, this is how it starts. This is how the whole Drysocket starts. You as a dental assistant end up talking to your patient at the end of the extractions, the procedure, whatever the case. And what happens is sometimes the patient's not truly listening to you because they just went through a traumatic experience for them. They have their tooth taken out. It's always better to give than to receive. And so in that category, so therefore when you're taking that tooth out, you're taking part of them that they've had for many, many years. And you have to think like that. It's kind of like under the critical thinking skills, okay? And when that happens, depending on the medication that they're on as well, you know, some people take blood thinners. It is so important. I cannot stress this enough. That when you are like looking at the schedule for the day ahead or that day, or you're walking back an emergency patient, that you take a health history. If it's been more than 6 months, you just always ask your patient, because it could have been just 2 weeks ago they were in the office and they could have had a change in their health history. I cannot stress enough to ask about their health history update and to get them to sign it. Because there's particular medications out there that while they're under that RX, that was prescribed by their doctor, their medical doctor, they cannot have oral surgery. So you need to always check the health history, because God forbid someone passes away on your watch. I'm not saying this to scare you, but some assistants, in the last video I told you can get into all these little categories once you become a dental assistant. And one of them might be is an oral surgeon, you know, assistant. And that's where you go to the hospital once or twice a month, depends on the office, and do like the cases that are really, you know, involved. So now we're going to continue on about the Drysocket. So the tooth was taken out and removed. I'm going to use my Play-Doh set, okay, because it does look the best for a Drysocket. It's open. There's nothing there. All the teeth are missing. And what did they do? They didn't follow the post-operative care, okay? And I'm going to read them to you. You know, when a surgery is completed, the patient will be escorted to the recovery area to rest and allow sedation to wear off. Now, if it's nitrous that they were under, and you run that oxygen through, you flush the tubes of the oxygen, and you have to get your nitrous license in order to sit in with a patient. So you need that, definitely, if you're going to get into oral surgery. But that's a whole nother topic. Therefore, and there's a web page that I have that you can click on and understand that stuff a little bit more. But anyway, always walk your patient after the procedure to the checkout, okay? Now, you might decide not to even become an EFDA. You may decide not to even be an assistant. You might decide to be front office, a dental receptionist, whatever the case. They have different titles. So you might want to check out that patient before the procedure is done. And you just say, Mrs. Jones, I know you're not going to really want to talk after the procedure. You're going to be numb from the anesthetic. I don't want you to take a chance to bite your lip, cheek, or tongue. Would you like to take care of the transaction prior to the procedure? And most time they'll say yes. And if there's any difference, you can work out something with them and submit what you need for insurance. Now, make sure, this is another one besides health history, and it's getting off the topic, but that's how I teach, okay? Because you need to know all of this if you just ask me personally. But you need to make sure you have a photograph of that tooth, because nowadays insurance will definitely cover an extraction by a photograph. But you also need the current x-ray, okay? So, and if for some reason you forget to take an x-ray, check around with specialists that you might refer them to or something, but you really need to have that x-ray, okay? So x-ray, health history, okay? And walk the patient, escort them to the office, okay? Now, getting back to the Drysocket. So they have the tooth removed, okay? And who gets to put the Drysocket paste in? Well, expanded function dental assistants can, but in some states, the dental assistant is allowed to. I did many times, okay? And what you do is, and you'll know it's a Drysocket because, and you have to tell them it's going to hurt worse than a toothache. Let me go to the post-op care instructions. I could probably do it off the top of my head. So, I'm going to pretend you just had a tooth taken out. I'm your dental assistant. Mrs. Jones, you did wonderful during the procedure. I know you're not feeling too comfortable right now. Do you want to sit up more? Are you comfortable? What can I get you? And then I'm going to go ahead and go over the post-op instructions. Just talk to them like you would talk to your mom or dad, but in a respectful way, if in case, everybody's built differently in their homes. But going back to it, it's your bedside manner that you're about to show off when you take care of your patients. That is your bedside manner. And you want, and it's not a bed, and don't even think that, because I have a blog on that and a book on that under Amazon. But what you want to do, that means the patient's chair, how you behave in front of your patient. And you'll see some doctors have different kinds of bedside manners when it comes to the patient. Sometimes the assistants, but that happens. So always keep it professional. That's just your little conscience reminding you, from me to you. Anyway, here we go. So you're sitting there. I'm going to go ahead. I'm rambling. I just had a blooper. Here we go. Okay. So, Mrs. Jones, you just had the lower right tooth removed. And make sure you always get the right tooth. I've seen it. I've had to stop a doctor. I'm back, guys. I talk a lot. So here we go. I've actually seen a doctor before take out a permanent tooth almost on a child. And we weren't supposed to be extracting that tooth. And I kind of told him, and this is something you need to know too, this is part of bedside manner, is when he was about to take that tooth out, instead of blurting it out, "Oh my God, you're about to take the wrong tooth out, doctor," and maybe the parent's right there, you kind of just go with your finger and point and talk with your eyes because you got the mask on, or get a little sticky note. And if you're going to write when there's oral surgery, have a little plastic cover over the pen just to help protect from germs. And then write it on a sticky note, wrong tooth or something. If you know